Have you ever wondered how the different levels of autism get diagnosed? How is someone with a level 1 autism diagnosis different than someone with a level 3? Hi, I'm Dr. James Thatcher, and I've been doing these autism evaluations for a very long time. And today, I'm going to go over the 3 different support levels of autism, along with how they get determined and diagnosed. Here we go. So level 1 would normally be called what's called mild autism, although I would caution against this. It would have been considered Asperger's syndrome years and years ago, according to the old diagnoses. It's no longer considered that. Autism is now on a spectrum to where there's different levels, and those levels look at the different support needs. Folks with level 1, you're going to find that maybe they're kind of quirky. Maybe they respond to social overtures a little bit differently. Social overtures mean when you reach out to them, how they respond back. And I should also say that I'm going to speak in generalities today. When you meet an autistic person, that's all you just did, is that you just met an autistic person. Everyone is different, including folks on the spectrum. Another thing that I run into with folks with level 1 autism is that their vocabulary tends to be either average to even extremely high on cognitive tests. And on top of that, folks with level 1 autism tend to have average to very high intelligence. One thing that I will see is even though their expressive language, meaning them being able to speak, is just fine, what tends to be an issue is what's called social pragmatic communication. So that's holding a conversation, like a back and forth conversation with another person. That can be more difficult. Another thing that you may see with someone with level 1 autism is that they may have some fixations, they may have some rigidities, and they may get anxiety or kind of upset when things go outside of the normal routine. Another thing about communication that I've noticed with folks on level 1 is in regards to their social pragmatic, they tend to be aware that they come off a little bit differently. So what ends up happening, unfortunately, is a lot of masking and scripting, which takes a lot of emotional and mental energy to put into that. So when they do that, they may develop other issues like anxiety and depression just because of all the social demands that go into scripting and putting on a mask when that's not really who they are. Another thing you may notice with folks with level 1 autism is they may come off as blunt, just very straightforward. And to some folks, it may come off as rude. But I will say, just in my own personal experience, just because I've worked with a lot of folks on the spectrum, and part of my job is the testing, I don't mind that at all. Professional life, personal life, I tend to know what's going on, and I know that they don't mean it personally. That's just how they're communicating. They're not being malicious or trying to hurt your feelings. They're just telling it like it is. And I find that very refreshing. And in fact, I really enjoy when patients and people can just be themselves around me. That's what I want. Level 2 autism is requiring substantial support. Folks with this, you're gonna be able to notice that there's some difficulties going on with social communication, holding conversations with other people. Maybe conversations are restricted to just people that they kind of know very well. Or maybe they tend to just talk about what they're interested in, to where they'll just monologue at you instead of asking you what you're interested in or engaging in something back and forth. And it'll be fairly obvious. You also may notice a lot of rigidities, fixations, sensory sensitivities that can overwhelm them. Folks on the spectrum with sensory issues, it can be painful. It's debilitating. And with more level 2, again, some individuals, it can be so debilitating that if they're in a bright room or a crowded area, or a smell hits them, they will have a visceral reaction or melt down or start crying and need to leave because it is painful for them to be able to be in that environment. Another thing that you may see is some language stereotypies like echolalia. So repeating words or phrases back to you after you say them. Something else that might be happening is a lot of difficulty with self-care. So not regularly taking a shower, not brushing their teeth, not being able to pick out the correct clothes for the day, things like that. Another thing that you may notice is noticeable distress whenever there's a change in routine. If something is different, it really bothers them. Their anxiety will go way up. If they're in the classroom and there's a substitute teacher, that can be a problem. If you don't go directly home from school when you usually do that and you make a stopper along the way, that could be a meltdown. And lastly, level 3. This is requiring very substantial support. These are going to be individuals that sometimes may be in what's called a care home, to where they need support staff around them because they can't care for themselves. Language is going to be difficult for them. They may only communicate just to get their needs met, and that communication might not be verbal. Maybe it's through visual means like pointing at a chart. Maybe that's some basic sign language, and maybe it's just a couple of words at a time. How is one of these levels determined during an evaluation? There's 3 different levels: level 1, mild; level 2, moderate; level 3, which is severe. And in order to determine where someone falls on that, I've got to look at 3 different areas. I've got to look at their communication abilities, I've got to look at their adaptive behaviors, and I've got to look at the severity of the symptoms. So let's go with communication level. To backtrack a little bit again, someone with level 1, they can speak just fine. It just may be the social pragmatic issues that may be fouling them up, holding a conversation, like a back and forth conversation with someone, but their verbal abilities are just fine, if not better than most people. Level 2, they're going to have much more difficulties. It may be more phrase speech. It may be more simplistic. They may keep going back to the same topic over and over again, and definitely not engaging in a back and forth conversation. And then, of course, level 3, hardly any words at all, if any. The other area that I look at is adaptive behaviors. So what's their self-care like? What's their self-direction? Are they able to follow through on tasks? What's their social abilities? What's their daily living skills? Are they brushing their teeth? Are they paying their bills? Are they able to order a meal when they go out in the community? Community use. Do they take a bus? Do they know how to take a bus? Are they able to drive their own car? Things like that. And in order to determine this, I use what's called an adaptive behavior measure. I use what's called the ABAS. I talk about that in another video. I'll try to leave a link down below. And the third area that I look at is the severity of the symptoms. So how impactful are all of these different autism symptoms on their daily life? See how all these 3 areas, even though they're a little bit different, there's some overlap between them. So how severe are they? Are they impacting them? So is their echolalia so bad that they can barely engage in a conversation? Are their fixations so bad that they're choosing them over socializing other people or engaging in daily living tasks? So if they're really into paint swabs or Star Wars, are they just doing that all the time, playing the video games, making little paint swabs, instead of going out, taking care of themselves, holding a job? Again, how impactful are these symptoms for them? Or the sensory sensitivities? Are they able to go out in public? Or is even just going to a restaurant with the different noises and the smells, is that just too much? How impactful is that to them? And the other thing to keep in mind is that even though someone may be a level 2, that doesn't mean that they have to be a level 2 forever. These areas of support are just that, are areas of support that they need for that point in time. So someone at a level 2, if they get some extra support and they respond very well, they can move up to more of a level 1, to where maybe they're holding a job and they have relationships and they buy a house. Or unfortunately, the opposite can happen. Someone can be at a level 1 or a level 2, maybe not get the support that they need, or something neurological is going on as they're developing, and they end up being more of a level 3 as they get older. Social demands increase over time. Sometimes neurologically, the sensory issues can get better or get worse. It just depends. Again, everyone is an individual and everyone grows and develops a different way. I hope you found this video very informative and that you liked it. If you did, please leave a comment, hit subscribe, let me know what you think. I will respond back to you if you have questions about this. If you liked this video, please go ahead and like on this one up here where I talk about the autism process and I go over the adaptive behavior measures that I talked about before. All right. Hopefully I see you there. Take care. Bye-bye.